डॉक्टर संजय, आज कौन है प्रेजेंटर?
डॉक्टर कुंजन किकानी।
Oh yes.
Yes, Dr. Kunjan. You are self-muted. Kunjan, you are self-muted.
Please unmute yourself, Dr. Kunjan. Yes.
Hello.
Yes, yes. Say something, Kunjan.
Okay, bye. Okay, bye, beta. डॉक्टर कुंजन प्लीज कुछ बोलें, आपकी आवाज नहीं आ रही है। आप कनेक्टेड तो हो? हाँ, यस। एक पूरा सेंटेंस बोलें। हेलो।
Hello.
डॉक्टर कुंजन कुछ बोलें।
Hello. Am I audible?
Yes. Yes, you are
Okay.
audible.
Okay, sir. Thank you, sir. I was trying, but I think that Bluetooth was not working. So right now with computer audio, I think it is audible. And my screen is, sir, visible?
Yes, perfect.
Okay, sir. So let me know when I need to start.
We'll wait for 3-4 minutes more, bus.
Okay. Okay, sir.
आप jumping jacks? हाँ? हाँ हाँ आज मैं लेके नहीं आया तो कुछ और कर लें देखता हूँ होगा प्लीज स्टार्ट
Okay, sir. Thank you. Thank you very much, sir. Welcome, dear friends. So today's topic is assessment in CBME. Today we will be taking microbiology perspective. I first I would like to clarify that I'm not the expert of who can talk about the assessment in CBME. So I recommend that on our classroom there is one link is shared, which is the lecture which was delivered by uh, Dr. Tejinder Singh. So all must go through that lecture also. It is 2 hour session, but I think lecture is about 1 hour, and then there is question answer. So I sincerely request that all of us must go through that lecture. That would clarify many points very clearly. So what here we'll be discussing today would be how we have implemented in microbiology for trial basis in this year only. So with this clarification, I would like to start my talk. So if we see objective of today's session, so first we'll briefly see what is role of assessment in competency based medical education, then assessment for learning, that is a new thing which I would like to stress upon. And then in microbiology, in theory, we have long questions, short questions. We already are doing these things, but like blueprinting may be done for question paper. Peer review is the must, because if I am setting the question paper, I may not notice the lacunae of that question paper. So always we used to do peer review. So even our HOD shows paper to APs. So even some minor uh, some lacunae is there, they may point out the thing. We all discuss, and then
हाँ हाँ थोड़ा सा हेलो
There is a loss of electricity because of a rain. I think it is. Hello, am I audible?
you are audible
Yeah, I had to change my setup from Wi-Fi to mobile. Probably there must be the problem. Last few days we are having this rain problem.
Dr. Kunjan, we can't hear you.
Okay.
Yes, Dr. Kunjan, you will have to go one slide back.
Okay, sir. Okay, I'm starting. Now is that
Leave this
audible, sir?
part, this much you have done after this.
Okay. Objectives were clear? Okay.
Okay, from
So,
here, yes, so you can start from objectives. You can start from objectives, yes.
okay.
Yes.
So the objectives are, I think light connection was there, so Wi-Fi connection was lost, so net was, now it is on mobile. So the objectives would be, we will see first few slides regarding assessment in CBME. The second thing is assessment for learning. Then we'll see theory question, long question and short questions. For that, I recommend that the blueprinting should be followed, that how much are from recall, how much should be from the comprehension, how much from the application, that should be done. And for practical, the OSPI and DOPS are there, and spotting. That would be related to microbiology. So that we'll be discussing. So what is CBME? There are so many.
Kunjan,
Yes.
we'll have a session on blueprinting in coming days. Right?
Okay. So I'm not discussing blueprinting right now. Okay. So what is CBME? So there are so many definitions, but as said by Dr. Tejinder Singh very well, that CBME in crux is a good assessment. If you do assessment well, student would learn the desired competency very well, because it is said that assessment drives learning. So if you have to choose between good assessment and good teaching learning method, you should go with good assessment, that student would automatically learn the thing which you are going to ask. So the assessment is the most important thing in the CBME. So this thing we know, that assessment of learning, this we have been doing for years, that would tell the teacher to use evidence of students learning to assess the student achievement against the learning goal and the standard, and teacher would grade it as per the, or he would give marks as per his performance. Now the other thing which needs to be done is assessment as learning. This is new thing where it involves student in the learning process, where they monitor their own progress, ask question and practice skills. Student may use self-assessment and teachers feedback to reflect on their learning, and they would learn and they would monitor their progress. And one more would be assessment for learning. Now, this is very important in CBME. It would enable teachers to use information about students' knowledge. When we do formative assessment, understanding the skill to inform their teaching, teacher would provide feedback to the student about their learning and how to improve. This would also tell the teacher about if any change at all is required in the teaching learning method also. So the assessment for learning. So for example, if we are doing assessment, if instead of giving only score, for example, I have given uh, 2 out of 5 mark in any short note, but student would not, if I'm not explaining why you have got 2 and what should be, what you have done better to achieve more marks, then that would not tell student what are the mistakes of him or her. So if you have prepared some keys for marking that short note, you should display that key. That for example, in laboratory diagnosis of malaria, if it is a 5 marks short note, I am giving 2 marks for writing about the peripheral blood smear, thin and thick smear, 1 mark for drawing the figure of the morphological forms of the malarial parasite, 1 mark for the serological test, antigen detection, 1 mark for other molecular tests. For example, that is my key. It should be spelled out clearly after examination. So they would use that key and they would learn that, okay, I have not drawn the figure, so 1 mark was cut there. So that is the thing. So effective feedback is the most important and crucial part of the formative assessment. Adjusting teaching according to the result. We may change the teaching learning method, and student ability to assess themselves with understanding on how to improve. So that is the thing. And the concept of more is very important. Dil mange more. So basically, by definition, CBME is a robust and multifaceted assessment. So there should be more sample size, there should be more content, there should be more tools used, more exam settings would be like theory, viva, practicals, OSP, and many. Involve more and more examiners. Instead of taking only 2 senior examiners taking exams, you should involve more examiners, and there should be more occasions of the examination. So obviously this would require more resources, more faculties, more, for example, if OSP is there, it would need more time, and everything more would be required definitely to achieve this. Now, utility of assessment, again, it is very well described by Dr. Tejinder Singh. I am just touching this. Basically, utility would be proportional to validity of the exam, whether that tool is valid, the examination which you are using is valid to test that particular skill, its reliability, its acceptability, its feasibility, and its educational impact. So not a single exam is good in all that. Yeah. So for example, if we take MCQ test in Google form, it is very reliable and acceptable and feasible, but educational impact may be low. It may be good when you are doing DOPS and you give the feedback directly. So when we use many such different type of examination system, we can use advantages of all. Now I'm coming to our questions, like in long question, when we want to test the comprehension. For example, you all must be knowing that problem solving type of questions. Like for example, this is one question that a 26-year-old female patient presented with 2 days of history of fever, increased frequency of maturation in dysuria, urine routine examination reveals plenty of pus cells in the urine. Now, with this brief clinical history, there are structured questions like, what is the most probable clinical diagnosis of this condition? Enumerate 4 common bacterial agents responsible for this clinical condition. Write down common predisposing factors leading to such infection, and describe laboratory diagnosis of given clinic. So what we have taught, the competency of urinary tract infection was there. It can be assessed well in such long question. Then there may be short question which may be framed instead of just recalling the thing. We may ask, give scientific reason. So like cephalosporins are not used for the treatment of ESBL producing gram-negative bacilli. So student must be knowing that what ESBL is, what is the mechanism, and what is the result. If an organism is ESBL producer, they are resistant to penicillins and cephalosporins. Like that, IgG estimation may not be reliable tool in the diagnosis of neonatal infection. So that from the immunology, from bacteriology, like long-term penicillin prophylaxis is indicated for streptococcal pharyngitis in children. So they must be knowing about the post-streptococcal sequel. So such question may be asked. For example, from parasitology, you know that in spleen there are so many hemacigot form, but there is a danger of bleeding and all that. So bone marrow aspiration is preferred over splenic puncture for diagnosis of leishmania. So such questions may be asked where the student need to comprehend. He would use, so from the level of nose he would reach to nose how. So that is the thing. Now same way we can prepare MCQs which would test the similar thing, like we may give history. Instead of asking name the organism which produces antibiotic associated diarrhea, if we give history that a patient is there, it develops diarrhea, and patient was on treatment of antibiotic for a longer time for some other infection, and that patient develops diarrhea, and patient the student should come with the answer of Clostridium difficile. So such, then there is a type of MCQ which is known as multiple compilation type of MCQ, where student needs to know many things about that person. For example, it is about laboratory diagnosis of syphilis. So there are 4 statements. Treponema can be visualized by dark ground microscopy. Loeffler serum slope can be used for the culturing. Cardiolipin antigen is used in non-treponemal, and TPHA test is used to monitor. So when student knowing the correct status of each statement, then only he would be able to answer this question. So such type of question should mean student must know that Treponema pallidum would not grow artificially in the media, like that. Or the 4th statement that treponemal tests are not used to monitor the treatment. So he must be knowing all 4 statements, then he would be able to answer this. So guesswork can be minimized. Again, comprehension can be checked. Same way we have prepared some spotting. For example, this is for immunology. There is a history and a figure. So from this, they must be knowing that it is a anaphylactic reaction. So such type of spotting with history can be prepared. So instead of just recalling, we put some instrument and they recall. They mug up 10 instruments which are available in laboratory. Here we can produce n number of different thing, and we can test their application here. Same way it can be made in such simple thing also, like for biomedical waste disposal. There are 4 different classes of biomedical waste, and they would be asked to identify the fill in the which color code bag should be used to dispose that waste. Same way for bacteriology, a 42-year-old male was admitted 4 days after crush injury, and he has neglected the injury and tied bandage over the injured side. On examination, there are symptoms of gas gangrene is there, and then we put either the slide which is focused in the microscope or picture, so they should be able to identify this. Same way it can be done for in mycology. You may put a history of oral thrush in patient with HIV/AIDS, and a slide which contains candida gram stain. So they would see the history, they would look in this slide, and they would answer the probable pathogen. Same way for virology, hepatitis B, various markers, reports can be kept, and he may be asked to interpret the report. That can be done. Or the CAR test of dengue, IgM or NS1 IgG can be asked, and uh, student may be asked to interpret the finding. So such spotting would test the application of the knowledge, and student would be, instead of mugging up the thing, he would apply the knowledge in that field. Then we had done OSP of gram stain. So there were 3 stations. One of the procedure station with a checklist. So the observer would have checklist with each point. So if there are various steps of the gram stain, you can decide marks as per when you feel that this point is more important, you may assign more mark. So as per your convenience and as per the peer review, you can decide the marking scheme. Like crystal violet, he has used for proper time, you may give 1 mark. If he has not done it, he has used crystal violet but timing is not perfect, you may reduce it to 0.5. Like that washing step, gram iodine, acetone, again washing, safranin, and air dry. So this is how you can give 5 marks. So it is a very objective. You can put even give this checklist to resident also. He would check it, and in then for roll number would be there, and he would give total mark out of 5, how much is scored. Then that slide would be allowed to dry. During the slide is drying, at that time the person would go to the question session of this training. Here, if you wish, you can put all 5 question of gram stain. If you want to wish, you may mix it with Zn stain also. So we had mixed. So these are the example of 5 questions. So what is modern? Explain isoelectric pH theory of gram stain. Which component of mycobacterial cell wall makes them acid fast? What modification in Zn stain would be required to stain Mycobacterium leprae? Write the uses of dark field microscope. So we have got 1 question from microscopy, 2 questions from Zn stain, and 2 from gram stain. So by that time the person is writing the answer, his slide would have been dried, and then he would go to the again 3rd station, which is procedure station, where he would be given time of 5 minutes, and these are the instructions that focus your slide in the microscope, draw the label diagram of and interpret the result, and show your finding to the examiner. So again here there would be 1 examiner required. So he would focus the slide and show it to examiner. So examiner would give out of 5 depending on the his interpretation, his quality of the staining, how he has focused, and that thing. So that can be done, and once that is finished, all procedure is finished, he need to wash his hand after doing this procedure. So we had kept dopes uh, in which he would be performing one procedure, and that is directly observed by the examiner. So in that, hand washing was kept as a dope. So first step, he wet the hands with the water and apply enough soap to cover all the hand surfaces. Then various steps of hand washing, like palm to palm, uh, back side, then finger interlaced, back of the finger, rotational rubbing of the thumb, both the hand, rotational rubbing with nails in the palm, rinse the hand, like dry hand with a paper towel. We had kept various paper towel there and use that paper towel to turn off the tap. Even that was given some importance, because otherwise what would happen, that with a contaminated hand he would open the tap, he would wash the hand, and when he closed the tap, he would again contaminate his hand. So each point you may peer review, you may increase or decrease the number of marks as per the importance. So just by giving 5 marks, he would learn this thing thoroughly. Nobody of, not a single student would miss this, and especially it should be very explicit. It should not be surprise element for the student, because uh, we want them to learn. So all your checklist should be very explicit and open. So he would learn, he would not make any mistake, and he would learn all these steps very clearly. In such type of thing, there are some global steps. For example, you have given 0.5 mark to each of these 10 steps. But first step, for example, he is taking enough soap. If he is not doing that, and he is doing all other 9 steps clearly, he would not get 4.5 marks out of 5 here, because that is the most important. If he is not taking the soap, rest of the step are meaningless. So if that step is missed, he would get 0 mark out of 5. So that should be taken care of. So that's about the directly observed procedural skill. And there are some qualitative methods, like you may grade them. You may not give mark, because in some of the thing marks would trivialize the thing. So there are certain things like grading may be given in journal. You may start A plus, B, C. Such grade may be given. So uh, they would uh, they would do better when they feel that, okay, journal is as checked and it is given grade. So they would obviously do proper. Assignment may be given grading. When they present seminar, they may be in the certificate. You may give certificate of presentation of seminar. In that you may give them grades. In tutorials about their understanding, their scientific approach, you may give grade. Uh, they may be given some projects, and when they submit that projects, they may be given grade. So they would be learning. And when you give grade, the specific feedback to enhance the learning, instead of doing, for example, if somebody has presented seminar and you are giving that person B grade or somebody A grade, you should give the specific feedback that what was good and what needs improvement, whether his presentation was poor, whether his content was good, whether the PowerPoint needs some improvement. So specific feedback would enhance the learning. So instead of non-specific or vague feedback, like bahut acha tha ya maza nahi aaya. Instead of that, we need to specify the point that were good, so it would reinforce and it would uh, motivate them to do that thing better. You also need to give feedback about what needs to be improved. So that's all about the our experience of the assessment. Though we have not started the CBME, but we had last time we had taken the first internal exam. We have tried this many things, and the student feedbacks are very nice. They have enjoyed this. Their marks has also improved, and their learning also has improved. So with this, I end my talk. Thank you. Now it is open for your suggestion and your feedback.
Thank you, Dr. Kunjan, for briefly stating the microbiology perspective of assessment. So I really appreciate that. Let us have a suggestion or feedback from the participant or any query or any questions, right, which they can pause. Dr. Prakash.
Sir,
Yes,
good evening, sir.
Good evening, good evening. Yes.
Sorry, sir, I could not get the speaker's name.
Dr. Kunjan.
Kunjan. So,
Kunjan.
Dr. Kunjan. Hello.
Yes, sir.
Dr.
Yes, sir.
Yeah.
Go
Good
ahead.
evening, Dr. Kunjan. Yeah. My presentation was very good. Whatever presented, assessment methods and all these things were very good. I think we could have added even the peer assessment. Peer.
Yes.
Peer assessment.
Yes, yes, sir.
Yeah. Also could have been added over here. How we do about that and how it can be graded. Those things also could have been added over here.
Sure. Sir, basically there is a complete educational toolbox which
Yeah.
includes all these things. What I had presented is our experience, what we have already started. So that was not,
Okay.
we have not yet started that thing. So that was not included in that thing. But yes, this is the beginning. We may
Yeah.
include as many assessment tool as possible to make it
Oh,
more
fine.
meaningful.
Okay, okay. Because
Dr.
so many are beginners.
Dr.
Yes, sir.
Prakash.
So they may not know that thing.
Yes,
Yeah,
sir.
yeah.
Basically, we all are sailing in same boats, and we can learn from each other.
Yeah, yeah, sure, sure. Thank you, sir.
Dr. Prakash, you can
Yes.
add in if your university or college has got such type of a system, right? Because it will make a little bit difficult because internal assessment and summative assessment are totally guided by the university. So
Yes,
if
sir.
you know about that, how it can
Yeah.
be done, you can share it with the group.
Sure, sure.
Okay, okay, right, definitely.
Okay.
So more number of assessment is always
Yeah,
better.
yeah. That's true.
Dr. Kishore, you are self-muted. Dr. Kishore?
Hello.
Yes, yes, Dr. Kishore.
Sir, good evening, sir.
Good evening.
Dr. Kunjan, sir, it's a very good presentation.
Thank you, sir.
Sir, one thing also can be added along with those questions. I think we can add extended matching questions, sir. EMQs.
Yes, yes,
That also
that
can be
can
added.
be.
Yeah, yeah. Like you have made one multiple choice compiled question. That was very good actually.
Yes.
And along with that, I
So,
think we can extended matching questions so that we can give a case scenario, and then we can just go through some of the questionnaire pattern, like each carrying 1 mark, about some 5 to 6 questions can be given, each carrying half mark or something like that.
yes, sir,
Yes,
that
yes.
can be done. So we
You
should
are
try to include as per I think if you have seen in USMLE pattern of the exam, there are
Yeah.
different type of MCQs are
Yes, sir. Yes.
have been. So that can be at least in formative assessment. We should start that.
Yes. Yes, sir. Yes. Sorry.
Yes, you are
Thank you.
very
Thank
right,
you.
Dr. Kishore. Dr. Kishore, we
Yes, sir.
will discuss the blueprinting, and in blueprinting we'll discuss how to basically frame the assessment pattern and at
Yes, sir.
which
Yes.
level what questions to be added. Definitely, plenty of things we can add. Only thing is that we need to move from knowledge area to comprehension and application. Right. But once again, it is going to take a huge amount of time from the faculty members. That is going to be the biggest problem.
Actually, I think in the MCA has given one assessment pattern of booklet,
Yes,
which
yes.
has given some examples of pattern. Like for it is only given actually for the first MBBS students.
Yeah, it is not there for second MBBS, but
Second
definitely we will
MBBS,
discuss that
but
thing.
the
Yes, yes.
pattern almost comes the same, I think so.
Yeah. We will discuss in blueprinting, right? What
Yes, sir.
exactly can be done. Yes.
Sure, sir. Sure. Thank you. Thank you very much.
Dr. Raghavendra Rao has got some question. You can speak over here, sir. Dr. Rao, you are self-muted. Okay, he is asking that to share the lecture. It is already shared. We'll also share it again. The purpose of this session was that to show you that rather than taking simple examination of a recall, how our question should be reframed from recall to comprehension and application, both in theory and in practical, how to apply that, and especially how to use OSPI and how to use DOPS in microbiology. Very similarly, we are supposed to add the infection control practices that can also be added either in OSPI or in DOPS, right? So we'll also discuss about that. Next week we'll discuss about the logbook with perspective of microbiology. Right, we'll not discuss in general about logbook, but we'll discuss exactly how we can prepare our logbook in microbiology. Yes, any other question or any suggestion from any of the participants? Okay, I don't see any hands right now. Dr. Bedi sir, would you like to comment something? Hello. Dr. Kunjan, am I audible?
Yes, sir.
Okay. Dr. Bedi?
Anji.
Would you like to add something? Yes, sir.
No, nothing.
Okay. I think there are no questions, right? So next Saturday we'll discuss about logbook.
Dr. Sarvat Fatima has raised her hand.
Okay. Yes, Dr. Fatima.
Anji.
Hello.
Yes,
Am
madam.
I audible, sir? Yeah.
Yes.
Yeah. Good evening, all of you. Yeah. It was a nice presentation by Dr. Kunjan. I have just one query, like regarding what should be the Hello. Hello.
Yes, ma'am. Go ahead.
What should be the percentage of direct recall questions in any assessment as per the MCI norms?
Okay, okay. Right now, okay, just a minute. See, as per the standard definition, that institution or university would decide. Right now, it is not being laid down for a particular subject, right? Generally, it is like that there are what we can say core area, non-core area, that is decided. Second thing is with regards to type of questions, which are the type of questions, short question, short note, and long questions, right? Then the level of the question, recall, comprehension, and application. Usually 50% would be of recall, then something around 30 to 40% would be of comprehension, and something around 10% for application, which we are talking about before this CBME, right? But in CBME, that percentage would change. That is what medical education around the world used to teach all the teachers. But definitely that would little bit now change, but we'll have to wait what will come up with the microbiology subject, right? But
Yes.
that is variable. Yes.
Yeah. So generally, the recall is to assess the core subject. So I think it is 50 to 60% as per what is the revised training what we received. The rest
Yes,
we
yes.
can go for comprehension and other things. That's
Yes,
what I
yes.
wanted to confirm. Thank you, sir.
Oh, welcome. Okay, so we'll meet again next Saturday with some discussion on logbook for microbiology. Right. Dr.
Okay.
मैंने आपको मतलब apologize करना था तो कल मैंने आपको ऑन्कोलॉजी ग्रुप से मैं
Dr. Bedi, we can end the session now.
तो वो कहता मैं नहीं पढ़ाऊंगा मैं कहा यार ठीक है
Must be busy with another session. Dr. Bedi?
मतलब मैंने आपको courtesy से क्या कह लो जैसे भी आप भी हो तो आपको ऐड कर दिया था ना हाँ वो आपने कोई ऊपर मैसेज भेजा कहता वो क्यों है यहाँ पे मैं नहीं कराऊंगा हाँ थोड़ा I could understand लेकिन मैं हाँ हाँ वो फिर वो थोड़ा सा है हाँ no human being in this world is indispensable. कोई एक चीज में अच्छा होता है कोई दूसरे एरिया में अच्छा होता है कुछ ये है कुछ वो है इट्स ऑल टीम वर्क
Dr. Shoaib. Dr. Shoaib.
Yes, sir. Good afternoon. Good evening, sir. It was a really wonderful presentation. You have mentioned various assessment methods. Sir, I would like to share something which we tried during our internal assessment.
Yes, sir.
Yes,
So
go ahead.
during the practical session, what we did during the Viva, when we take the oral session, so we had made the cheats. Okay, it was a different color coded cheats. So color colored is a red, orange, and yellow, or otherwise red, orange, or green. So red color cheat will have a hard question, and average question would be of orange color. So as per the I would say the hardness of the question, the most difficult question can be asked in the red cheat, and as for the and the most routine question can be asked in the green cheat. So as per the color coded, various question can be asked. So students, so there were various cheats available, and a student needs to pick up certain cheats. So 2 cheats from the difficult question, 2 cheats from the average question, and 2 from the easy question. So that way it can be structured, and there is less chance of subjectivity. So that thing we have tried during our internal assessment.
Okay,
Yes,
so
and
you are talking.
it would also give some fun element to students, so they would be interested to him doing such thing also. It would break the monotony of exam also. Such a thing. It can be done in the formative assessment well.
Shoaib, you are talking about internal examination Viva, right?
Yes, sir. Internal examination Viva. So we have
Okay,
made
so
different
this is,
color coded cheats.
yeah.
Yes.
I understood that. So this is a structured Viva, and structured Viva, you have prepared a list of questions, and list of questions
Yes.
are divided into various categories. That means
Yes.
easy question, moderate questions, and hard question,
And
right?
hard question. Yes, sir.
Definitely, it is a very good pattern, and this will definitely will have a uniformity. Right, very right. It can be done. Yes.
Thank you, sir.
Oh, welcome.
Hello.
Yes. Yes, Dr. Bedi, I think you can close the session now, and next
Yes,
day
sir.
we'll have a on logbook.
Okay.
Hmm?
Yes.